Karishma, given the underrepresentation of women surgeons in the plastic surgery field, what inspired you to opt for plastic surgery as your career? And as this is a vast specialty, what exactly is your specialty?
Well, my inspiration is all about, it started with plastic surgery being the diverse medical specialty that is, and it has such a beautiful blend of science, artistry, and final impact.
Absolutely, yes.
That is one. And then the severe underrepresentation of women in the field of surgery by itself.
Yes.
Plastic surgery comes next.
Yes.
So we all have to become general surgeons, then we become either a neurosurgeon or plastic or a cardiac surgeon.
Okay.
And this gap of large difference and underrepresentation is one of those motivating factors which actually took me. And plastic surgery is so vast in terms of, I call it a head to toe profession.
Yes.
Where we deal with everything from a hair transplant to body aesthetics, facial aesthetics. That is the aesthetic part of it.
Yeah.
And then you could do a trauma, injury, birth defects, and also reconstruction.
Yeah.
So it is plastic, reconstructive, and aesthetic surgery. So being such a vast medical specialty, underrepresented, I want to close the gap for the women and make sure that we are represented. And I think in the last decade, the number of plastic surgeons are more with women in the country.
Yeah. So what exactly is your specialty in this field?
So I extremely love to do aesthetic surgery, and especially facial aesthetics, that is rhinoplasty, and the body contouring procedures, which is liposuction, a tummy tuck. It could be a Brazilian butt lift. It could be breast surgeries. So all of this, as in when I started my career about 15 years back, and I was mainly a plastic reconstructive surgeon. So I was dealing with trauma-related reconstruction, injury-related, birth deformities like the cleft lip and cleft palate, and also hand injuries, facial-maxillary injuries, as well as burn injuries. And most of our training, we are trained as a plastic surgeon to do this. However, my interest always lies with the aesthetics, and I love aesthetics. I love the creativity. There is something new to create on every single basis. You can transform someone's life with just something small. And I think aesthetic surgery was part of reconstructive surgery. So because even if I'm reconstructing a trauma, I am finally giving an aesthetic result. So we are providing function as well as cosmetics. So my main forte finally came down to aesthetic surgery, and I decided to start my own daycare plastic surgery center in Bangalore 6 years back. And